We started the study as patients because we had the impression that the patient-reported outcomes that we saw in clinical environments were, say, different from the ones that we saw being patients. And what we have decided to do is, with all our 28 members in the different European countries, to start a study based on the same questionnaires that are used in clinical environments. And we used the EPIC 26, we used EORTC Q30, and the EQ5D5L questionnaires. We translated those questionnaires into 19 languages. Of course, the translations were validated, and so that every patient could answer in their own mother tongue. And furthermore, we designed an online survey, so the patient was at home, at ease when answering the questions. So that was the design of the study. We needed 1,000 answers to be statistically relevant, but the study generated nearly 3,000 answers from 24 countries all over Europe, which means that it's estimated that 0.1% of the patient population in Europe, which we estimate at 3 million. We had quite a good coverage over the countries, with slightly less in the south of Europe and a little bit more or less in Eastern Europe, which is not surprising. The average age of the respondents was 70 years, and it was, and the diagnosis of those respondents was 64 years. So in fact, we are very glad that we have a quality of life study which represents on average 5 years after treatment, which is, I think, first ever done. That has not happened. And most of the patients also are living with a partner, so that also that's an important aspect, because we found that sexual function and incontinence is very high. If you look at the treatment, it's, I think, a very good profile that we found. 66% of the patients only had one treatment, and the rest was 2 or more. If you look at the curve of the treatment, it's more or less what we see in real life. So it's a representative study. If you then look at the results, if you look at the EORTC results, what was striking, and we didn't expect that to that level, is that insomnia and fatigue were the 2 elements where the patients complained the most about, and with much higher figures than we all knew, and also than the healthcare professionals knew. If you look at the fatigue score, it's very clear that if you have radiation therapy, the fatigue doubles, and it triples once you have chemo. The last element was not surprising to us, but the radiation therapy figure was much higher than we thought. And also, if you look at the insomnia, it was not known before that, but we saw that insomnia was a major effect of prostate cancer treatment. And there we found that if you have a progression in your disease or treatment that is taking long, that your insomnia problems are bigger. And if you furthermore look at the EPIC scores, and you look at the incontinence score, that was also surprising. Well, it was not surprising that if you had a radical prostatectomy that you had incontinence, but the amount was very big. It's about 40% of the patients who are still using pads after 5 years, which is much more than taught and much more than seen in clinical studies, which are always limited to certain hospitals and certain surgeons. So generally speaking, what we found was that the burden for the patient is much higher than thought as overall, and also that the further you go in the journey, the earlier you can treat the cancer, the less the effect is. And the only treatment that doesn't have an effect on quality of life is active surveillance. And that's a strong message, I think, that we want to give, that we should promote active surveillance for all patients as long as it is safe, and only treat patients when there is really a need to do so. What I like to say to finalize is that this study confirms our strategy. I mean, the strategy that we always promoted for prostate cancer is make sure that there is an awareness. And last year we did a small study. Only 50% of the men in Europe are aware that they have a prostate and that they can have prostate cancer. So, and only 50% of the healthcare professionals, they promote early detection. So we say awareness is key, early detection is key in order to give the best quality of life for patients. And the third element is that you need to treat those patients in cancer centers. If you look at our study, you see that only 13% of all the patients who are having problems with their sex life are using devices or pills in order to do something on it, whilst more than 50% find it a very big problem. So that's a lack of help and a lack of, let's say, professional advice that has not been given to those patients. And I think that if you treat them in cancer centers and compulsory in cancer centers, then the chances that you are doing that are much, much higher.